Hey, I'm Dr. Todd and talking about BPC-157 today. This is the peptide that I get asked about the most, mainly because people have heard about it from somebody else. They may have had a friend or a family member or heard it on a podcast, somebody talking about the incredible benefits of it. And what are the incredible benefits? It is really for joint pain and inflammation. That's where people are, talking about the results that they see with this. And the reason why body protective compound 157 is generated naturally in our gut. It is part of our immune system when we have an injury. But as an injury goes on, the body kind of just forgets about it. We have this emergency situation that the body comes in and just, hey, it stops the bleeding, it stops the craziness there, tries to repair the best it can, and then kind of forgets about it. And body protective compound 157 is there initially, but then may retract away. So using BPC-157, like I do, for instance, like a shoulder in the area, increases that peptide to that area. And here's what we get. There is immediate, basically signaling. And this is how our immune system works when we have an injury, is signaling. And that body protective compound 157 signals the body to reconnect to that area. So we get this thing called angiogenesis, which is a new blood flow, but new blood vessel growth to that area to actually help the exchange of that congested area, as you imagine scar tissue and just congestion of that area. So it also has amazing cytoprotection components to it, meaning that it's basically like an antioxidant for the cells and the nervous system. So we're getting more blood flow, we're getting protection like a shield to the area, and then we also get this stimulation of fibroblasts, which is what repairs. Now, you want to get a little crazy in combo with that with TB500 or thymosin beta 4, then we're actually having actin activated, which is actually the precursor to repair ligaments and tendons and other soft tissue along those lines. So this is why people call it the Wolverine blend. It's absolutely phenomenal for actually facilitating a new healing process. Nitric oxide to the area, vasodilates, new blood vessel growth, cell protection, and then the whole repair process. And what you see symptomatically is a reduced pain, reduced inflammation, and a joint that feels tons better in just a short period of time. I always tell people, like, if you're gonna take an ibuprofen, you might as well take BPC. Now, you can take it injectable, or there are oral versions. It's one of the only peptides that you should actually consider in an oral version, mainly because it is generated in the gut. Oh yeah, by the way, a lot of people will talk about it as healing the gut. And we've seen leaky gut start to repair with this. All sorts of inflammatory bowel-like types of symptoms repair with BPC alone. So it's a great side effect of that. If you want my protocols, what we do, work with athletes on a daily basis, that protocol I give them with BPC and TB500 to get their injuries back on track really quick, not only just the inflammation down, but the repair faster than anything we've ever seen. Just comment in the links below. Of course, like and subscribe for more information on peptides, as we'll be talking about peptides all the time.